The choice of antidepressant, selective serotonin reuptake inhibitors are well tolerated and are generally recommended as first line pharmacological treatment of depression. So, when you are considering pharmacotherapy for depression, SSRIs are the first choice. Okay. Individual antidepressant vary in terms of side effects, tolerability and response. So, the head-to-head trial in between SSRIs, it is generally regarded as one SSRI is not superior over other SSRI. It all depends on the comorbid conditions and if the patient is on any other medications, whether there is a drug interaction or previous response or family history, whether the individual has responded to particular treatments. Okay, the individual antidepressant is chosen based on these factors rather than any superiority trial. Okay, generally among antidepressants, SSRIs are tolerated better over dual antidepressants like SNRIs like desvenlafaxine, etc., or tricyclics. Tricyclics are very effective agents but not generally well tolerated. Okay, it has lots of side effects. So, choice of antidepressant as per Maudsley, the first line is SSRIs, and the choice of SSRI is left to the individual clinicians. So, side effects as a whole, generally headache, GI symptoms, nausea, vomiting, or some increased motility. Sexual dysfunctions are one of the common side effects of antidepressant, especially SSRI. GI bleed, especially when taken along with NSAIDs. Okay, and we have to warn the patients if they are taking along with the NSAID, non-steroidal anti-inflammatory drug, the risk of GI bleed is more. Hyponatremia, especially when you are prescribing SSRIs for older individual. Okay, they are prone for hyponatremia. Discontinuation syndrome, when it is stopped or there is don't have a response, when you change, there is a risk of withdrawal symptoms. And TCAs, additionally, they have risk of hypotension, tachycardia and QTC prolongation. So, we have to be careful. Monoamine oxidase inhibitors, tyramine reaction. When you take with foods containing tyramine, you have to warn them when you prescribe monoamine oxidase inhibitors. But generally, monoamine oxidase inhibitors are not generally used as in the treatment of depression nowadays. So, minimal effective dose. So, you can, there is nothing to teach, you can just take a screenshot of this page and keep it. The practitioners who are beginning, like, you can just refer to this slide. Okay, so this is a minimal effective dose where you have to keep an individual at least on this dose for the antidepressant effect to be visible. Sometimes, very rarely, suboptimal dose in some individuals can cause improvement, but generally adult, this is a minimal effective dose. In children, sometimes less than minimal dose gives improvements. In adults, this is generally preferred.